All right, we are here today at Utah Orthopedics with the lead therapist, Tim Whitaker. He is going to go over some therapeutic modalities for plantar fasciitis and Achilles tendonitis. And he's going to go over some techniques that hurry up and get you back to sport. So today, Tim, what are we going to go over?
So today I'm utilizing a soft tissue technique, instrument assisted, for my friend Jared here, who's got some plantar fasciitis and some Achilles tendonitis going on. So basically what I do first is I grab one of these metal tools and just kind of prepare the skin with a little bit of either emollient or cream. This technique is very similar to what we call a Graston technique. We don't technically use that because we haven't purchased their very expensive tools. I do like this technique a little bit better than some of the other popular ones out there like A-stim or gua sha, because we technically can feel the vibrations of the skin adhesions below different surface areas of the skin. We can target areas better. I'm able to identify those lesions and communicate that with the patient, and we get superior outcomes utilizing something like this because we kind of keep the rehabilitative outcome in mind too, knowing that there's going to be stretches and other modalities and strengthening things that go along with a treatment kind of like this. On a larger body group area, I start with a larger tool. It's kind of nice for the therapist too because it helps give me something ergonomic to grip, and I can get a larger treatment surface area as I go. So I just kind of start right here with some gentle, we call these upstrokes, kind of go at like a 45-degree angle to the skin, and just kind of warming things up, promoting circulation to the area right here. There's different ways that you can do this. You can kind of pivot from one point and do like a fanning technique or a swivel. You can kind of get in. There's also kind of when you're kind of tight around here, around bonier structures, you can grab a tool that's a little bit more specific with a smaller edge, and you can kind of frame around some structures. Kind of the big thing that we do with a technique like this with a metal tool is we're trying to get in there and break up some adhesions that are deep to the skin, underneath the surface of the skin, and we like to go cross fiber, so against the grain of the anatomical structures. Having an anatomical mindset's pretty important, paramount to be able to get a good technique going here, get an appropriate treatment. But I like to kind of warm up that way, get a little bit specific on the tissues. It should last about 8 to 10 minutes per session, usually like 2 days between each time that we get a treatment going here. And I use my other hand that doesn't hold the tool usually to kind of put either tension or slack on the tissue to help me be a little bit more specific with what I'm trying to get going on. So with plantar fasciitis, a lot of the things that are most important is taking the pressure on the posterior portion of the lower leg here out of the picture. If you do a lot of jumping or running, it's a common thing this time of year right now in the early spring that you get runners that are going out to the trail that have been dormant for the whole winter. We just try to loosen that up, take some of the pressure off the plantar fascia, which is a ligament on the plantar surface of the foot, which causes a lot of people some pain. So I'm just identifying some either lesions or we call them trigger points here. I'm just going to kind of go from different hours of the clock in a circular pattern in here and break them up. Jared's probably not loving this too much, but it'll be effective
he's
at
loving that a
loosening
lot.
up this quad muscle quite a bit.
So after you get a treatment, could you go out and run on the same day? That'll be a question I think a lot of people will have is, how soon can they return back to running, cycling, boating, climbing after something like this?
After a single treatment?
Yeah, after a single treatment. Are they then able to go back to their activity at that point?
So to break up some deeper tissue kind of depends on both how deep we go, how much activity you've done leading up to the day of the treatment, and also your level of hydration. We are creating little micro adhesions in here, so we don't want to get too aggressive with a bunch of powering like right after.
Right.
But if you're kind of keeping in moderation a lot of the things with your hydration, and I'd probably give it at least 24 hours for you to kind of really relax. But
right.
I had a patient who had pain for about 6 months, and he gave me 1 week to be able to run in a local marathon, and he was able to participate in that race.
And I think that's kind of important because when you have treated me in the past, I'm able to go out and run the same day. But I'm kind of familiar with the technique. I've been getting some body work done for the last few years, so I kind of know what to expect. And for me, it helps me immediately return back to running. So maybe for somebody that's not experienced this before, they might get some bruising, they might be a little bit more sore than normal. So definitely that hydration is super important. So you just need to listen to your body. I think at that point is
Totally.
the important thing to take away from that. So besides doing the heel, the Achilles, and the calf, do you also work on the bottom of the foot?
Oh, absolutely.
Yeah, so let's maybe show them real quickly some of the things that you'll do on the bottom of the foot, just so they have a good idea of what to expect if they do ever
With the
opt to
plantar
do
fascia.
this. Yeah, and I'm going to swing around on this side.
Cool. So part of the key there, when I'm working on the bottom surface of the foot too, is I don't want to put pressure in and go away from the attachment point of the plantar fascia right here.
Right.
I always want to put pressure at that 45-degree angle, and I want to go towards the lesion. So the plantar fascia is attaching to this little tip right here on the bottom of the calcaneus, and I'm going to be working my way up towards there, kind of getting in there. The strokes are always going up towards the heel to warm up. When I'm going to be going a little bit more specific with my other tool here in a second, then I'll be kind of delving in a little bit deeper and more specifically utilizing like some J strokes, like I was talking about some framing a second ago.
Right. So besides this therapy, what other things should people be doing?
With plantar fasciitis?
Yeah, with plantar fasciitis or Achilles tendonitis, what would be kind of like something they should do during a typical day? So say when they wake up in the morning, what would you want them to do first
So
thing?
typically with plantar fasciitis, kind of the hallmark or like the first few steps in the day are the most painful.
Right.
I almost always recommend to get people stretching that calf.
Right.
It's imperative that you get that calf stretched out. And that's kind of throughout each day. You want to keep the tension off of that because the calf is attaching on the other side of the heel like this,
Mm-hmm.
and the plantar fascia is like that. So when the heel is tight from the calf muscle, it's separating. That's causing more than half of the issue in most cases.
Right.
So if we take away the tension from the calf right here, we can promote healing there.
Right.
A couple things that I really like is rolling your heel
Right.
on a frozen water bottle.
Yep.
I like it because it's dense, so it gives you a good stretch, but it's cold, so it's getting that nice local anti-inflammatory effect at the same time.
Right.
So I'm just kind of breaking up here, going across fiber a little bit. How are you feeling, Jared?
Good.
So a lot of this too, like when you have this done, is just communicating with your patient each time as well. Just making sure that they're comfortable. Everyone kind of tolerates the pressure differently, and you know, I'll kind of cater each treatment a little bit different, even from one time to the next, depending on how they're doing.
Right, and I think that's important to know is that when you first come in, obviously it's not going to be as hard, but by your second or third visit, you're certainly going to be digging in there a lot more, and you'll be able to tolerate it because you know what to expect.
That was your experience, right, Joel?
Yeah, well, I think just with anything, with any sort of therapy, with any sort of training, you always want to start somebody off kind of nice and easy just to get them used to it.
Totally.
And then you're going to ramp it up as they become more proficient or they become more tolerant of the therapy or the training regimen.
Sounds good.
Well, I think we've done a pretty good job of showing some of the therapy that you can get for plantar fasciitis and also some Achilles tendonitis. Do you have any final words to go over before we wrap this session up?
No, not really.
All right. Well, I appreciate it, Tim. Again, we're at Utah Orthopedics, so if you need to call these guys, you can find their phone number on the Bomber Athlete website, or you can give me a call, and I'll refer you to them. Thanks a lot, Tim. Thank you, Jared. I really appreciate it, and take care.